If you're about to turn 65 and trying to decide between traditional Medicare and Medicare Advantage, you need to know this. The federal government just cracked down on Medicare Advantage payments, and insurance company stock prices dropped almost immediately. This reaction tells you something important. So I'm a doctor, frustrated with the system, learning more about it and sharing what I learned. And this is why it should matter to you. So this year, the government slowed down how fast Medicare Advantage plans can increase their payments and tightened the rules on how they get paid. Wall Street noticed this right away because it directly affects how these plans make money. So why is Medicare Advantage such a big business? Medicare Advantage plans used to save Medicare money, but now they cost Medicare about 4 to 6% more per patient than traditional Medicare. Here's the key difference most people don't realize. With traditional Medicare, doctors and hospitals get paid for care as it's delivered, visit by visit. But with Medicare Advantage, insurance companies get a fixed amount per patient per month, adjusted for how sick that patient looks on paper. That means diagnoses matter, even when they don't change your care at all. So in real life, these plans have offered thousands of dollars to medical offices just to get patient records, not because the care was wrong, but to find diagnoses that increase what the plan gets paid by Medicare. This has happened to my office. So here's a simple example. A patient comes in for routine cataract surgery. Surgery goes perfectly. The plan isn't asking if diabetes affected the surgery. They're asking one thing. Does the patient have diabetes at all? If the answer is yes, the plan gets paid more, even though the care and the outcome are exactly the same. So now let's talk about where your Medicare dollars go. With traditional Medicare, about 98 to 99% of dollars go directly into healthcare. But with Medicare Advantage, the plans are only required to spend 85% on care. That means 15% can go into administrative, marketing, prior authorizations, executive pay, and profits. So this is also why Medicare Advantage plans rely more on prior authorizations, denials. Many services that don't need prior approval under traditional Medicare often do under Medicare Advantage plans. Government audits have shown that some denials were for care that traditional Medicare would have covered. So when the government is saying we're not going to keep paying more for paperwork instead of actual patient care, insurance companies push back. And I'm not saying Medicare Advantage is wrong for everyone. But if profits are under pressure, here's the question you should ask. Does that pressure show up as better care? Or does it show up as more denials, more delays, more barriers between you and your doctor? If you're choosing a Medicare plan, that's not political, it's personal.